दिस इज अ टिपिकल चाइल्ड, और यहाँ पर अगर मेरा बच्चा है, ओके, rather than going on this, I should come down, understand what is the stage of development, start working on it. कुछ improvements आएंगे, improvements को ना देखकर झट से धड़ाम से ऊपर ऊपर ना जाकर, कुछ लोग कभी कभी क्या होता है ना, चाइल्ड का आई कांटेक्ट होता है, चाइल्ड आई कांटेक्ट डेवलप होता है, चाइल्ड नाम को रिस्पॉन्स करना शुरू कर देता है, झट से पेरेंट को यहाँ पर जाना है, आई कांटेक्ट आ गया, ये आ गया, अभी उसने अभी झट से स्पीच करना शुरू, नो, नॉट, इट्स नॉट पॉसिबल। और अगर वो पॉसिबल भी है तो भी योर चाइल्ड इज गोइंग टू गेट स्टक इन सर्टेन एज स्टेज, क्योंकि आपने पीछे की चीजें की ही नहीं है। तो अगर यहाँ पर बच्चा है, अगर कुछ इंप्रूवमेंट्स आती है, इंप्रूवमेंट्स अगर आई है, तो आई टेल द पेरेंट टू गो बैक एंड स्टार्ट, ये इंप्रूवमेंट्स यहाँ पर आनी चाहिए थी, इस लेवल में आनी चाहिए थी, ओके, तो यहाँ से फिर से उसने जो भी चीजें मिस कर दी है ना, इसको हील करो, तब अब ये नॉर्मल इस स्टेज तक गया है। सो गो बैक, अगर वो वापस आगे जाता है, अगेन गो बैक एंड स्टार्ट हीलिंग द प्रीवियस थिंग जो उसने मिस कर दी थी। यहाँ पर और भी लोग हैं जिनको को भी समटाइम्स यू नो, आई 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 I get agitated, you know, and I talk to my friends and professionals in the conferences. You know, there are few professionals saying, Sumit, why you are so much agitated? Why you are getting these things? You know, अच्छा है ना, ये autism बढ़ रहा है, अच्छा है ना, काम मिल रहा है. And I really feel bad about them also and about people's mentality also. Many parents feel that I was straightforward and I criticize, but this thing is really getting problematic because of this. People don't want to go back, and this is something is a very technical, and you need to understand various approaches, और वेरियस अप्रोचेस में कौन सा अप्रोच उस स्टेज में आपको ये करना है, दैट मेडिकल मॉडल हैज नो आंसर ऑफ इट, मेडिकल मॉडल हैज ओनली वन आंसर, बिहेवियर को काम करो, हाइपर एक्टिव है तो उसको सेडेटिव दे दो, यू नो, but they don't have answer for the development. It's something which is very important. Go back every time the child goes. I remember there was parent. Uh, sorry, I'm just not talking communication. Autism आता है तो बहुत सारी चीजें एक साथ आती है. No. Uh, the child has started writing, reading, and child started doing everything. And I requested the parent. See, he is 6 years. I know he's doing good in studies, you know, but his social interaction still not great. His communication is still not great, and his behaving still. I mean, he is now he has reached child like a junior KG के बच्चों के साथ अभी वो करना शुरू कर रहा है, और हमारे ग्रुप डायरेक्टर से द चाइल्ड वाज डूइंग वेरी गुड, नो, बट पेरेंट्स का कहना था कि नाउ उसको अभी आ रहा है तो स्कूल भी बोल रहा है तो सेंड हिम अहेड। बच्चा आगे गया, फर्स्ट स्टैंडर्ड में गया, एंड फर्स्ट स्टैंडर्ड में ऐसे हुआ कि फॉर्मल कम्युनिकेशन, फॉर्मल एकेडमिक्स आना शुरू हो गया, इंटरेक्शन नहीं मिला उतना, दूसरे बच्चों ने उसको अलग से अलग थलग कर दिया, एंड चाइल्ड स्टार्टेड शोइंग अ लॉट ऑफ बिहेवियर्स जो एक्चुअली उसमें कभी था ही नहीं, एंड चाइल्ड आफ्टर 4 6 months दे कम बैक, पेरेंट्स कम टू मी एंड दे सेइंग यू आर राइट, नो, वाज आई सपोज्ड टू बी हैप्पी, in fact I was I could not sleep on that day कि I could not convince the parents keep him back in the senior KG। तो वो जूनियर केजी का बैच जब आगे आएगा, आपका बच्चा एक्चुअली उनके साथ जेल करके एक साथ आगे जाएगा। सॉरी, so communication is all about first social interaction, lots of parent child bonding, lots of mother child bonding, not training. Child wants to be a part of it, child wants to be a part of mother's function, child wants to wait when papa will come, child is not very happy papa is going to office. He's say 6 years, but now he's showing a behavior like a 2.5 year. Let's enjoy it. Every parent comes to me and say कि आपको क्या लगता है कि हमें कितना पेन है, you know, नॉर्मल बच्चा होने से you know क्या क्या जाने कि हमारा दर्द क्या है, नहीं, एवरी पेरेंट इज अ पेरेंट, बच्चा नॉर्मल हो या वो, पेरेंटिंग इज अ केयरिंग, पेरेंटिंग इज अंडरस्टैंडिंग, पेरेंटिंग इज गिविंग, पेरेंटिंग इज नॉट टेकिंग। If you want to go, I mean, I have taken a lot of lectures in these things. So whenever whenever we see a child, you know, I ask the parent how much bonding he has with you, how much he wants to imitate you, how much he enjoys with you, how much he's you are able to transfer your ideas, beliefs, thoughts to him, and then we should talk further, you know. And if it is not there, then that is the primary stage, that is social interaction with the family members first. फैमिली में इंटरेक्शन नहीं है और मैं अगर इसको दूसरे बच्चों में लेके जा रहा हूँ, that our kids will never take him, and that is why communication is getting affected in autism. Or let me tell you, there are few kids who came to me at the age of 12 years or 13 years, and child was not speaking. And when we started, in fact, not even offline, in online sessions, you know, during COVID, and Harshali knows it. Many kids, Harshali knows it. Child was not speaking, but when we started work, because parent also had a lot of time, they were sitting at home, and very calmly, very patiently, when in during the online sessions, when we worked on the child, one to one parent child, father child bonding, mother child bonding, when we worked, I saw many kids started speaking from that stage. Not speaking, again, I'm saying the wrong word. Started communicating, started transacting, the transaction increased. Parents started understanding the child, child started understanding parents, and wonderful bonding got created. So today, I believe last time I discussed how sensory modulation affects communication, and that affects communication. That affects, firstly, it affects social interaction. And today I discussed, you know, the algorithm of development, which is very important in terms of autism. Algorithm of development given by nature, given by God, so-called. Every religion's God is different, but whatever the Almighty has given, it is only one. Let's respect it. Let's understand where my child is operating from, and from there, if you take a right professional's guidance, I believe every child can come out of autism, because autism is only social interaction and communication dysfunction. Third thing is stereotypical. Ethically, sensory indication therapist can work on that also. I will stop here, but uh, that's it from my side. So uh, sometimes my lectures are straightforward, and sometimes they are like because facts always uh, are not always that great, you know, to hear. So that's it for this session of communication. Last time we discussed about modulation. Today we discussed about communications journey in the normal development. I think next time we will discuss about various reports and how we worked on communication. I can discuss that with you all. If you want to connect with us, if you want to join us, the number is there in the in the chat box. You can connect us anytime. Thank you Arshali for calling me every time. मैं थोड़ा सा नर्वस होता हूँ कि to begin with the lecture, but at the end of the session I get more excited. I get more I feel more that I should talk, but 1 hour is, I believe, I can we can discuss. So thank you for calling me for this lectures.